So folks, when we go to the doctor, we expect to be examined, diagnosed, and possibly given a prescription. But how many of us actually understand what our doctors are saying? Well, I know none of us can understand what him writes or she writes. I don't know how the pharmacists them read it. It's like I'm just going to say, and the pharmacist say, okay, this is what they need. How many of us actually know how the medications we're prescribed are going to help us? How many of us could clearly explain our medical conditions if we were asked to do so? Dr. Samantha Johnson is here to tell us how patient education and the lack thereof could be impacting our healthcare system. Good morning, Doc. Welcome to Smile.
Good morning. Thank you.
That was asking me to see you're right. But you're right, them too? But why? In a serious way, because sometimes I really actually look at it and I say, what is this? What the pharmacists don't understand.
And bless their hearts, because I think it's a mixture of some of us are just born that way, and then it's just years of trying to get it out really quickly. But, you know, when it comes to the pharmacists, thankfully, we usually have our numbers either in their system or on the paper. So they do actually call us
and what you mean?
and ask us what it's for, and also to ensure what we write is actually correct as well.
But before you get, but Neville, before we get to what they write, do you explain, or is it important to explain to the patients what is on the paper before we get to that point?
So of course, because that script is really for the pharmacist and not necessarily a note to the patient. So ideally, once we finish seeing our patient, we want to discuss the entirety, almost like a summary. And that is to kind of check that you understand, explain what has happened, but then also explain what the next steps are. This is also an opportunity for us to kind of talk about what is on the script itself, talk about what they can look out for, what complications they can possibly expect, and then what we do is called signposting. And that's really so you know when to come back if you have an issue and where you can go, just based on whatever is being presented at that time.
So Doc, I come to you, I drop on my shoulder hurting me. I say, Doc, I don't know where I'm going. You say, take these 2 tablets, you will feel better. What more I need to know about what I'm taking and how it can work and stuff? You just tell me, take these tablets. I know normally they say, take it its entirety, because sometimes you give it 10 and I take 2 and I feel good and I
yes,
and I
take
you
stop, right?
But
yes.
What else I need to know? You tell me, say, if I take the tablet, I go and feel better, and I take the tablet and I feel better. So what else I need to know?
So we've definitely skipped a few steps. You know, when you come in and you present with a complaint, ideally what we do is called taking a history. That's why we'll ask a lot of questions. And for persons who have maybe gone to a hospital, you realize, boy, I have to tell the same story all the time to like 3 different people. And that's because we're not going to rely on the notes. We want to hear what you have. And each healthcare practitioner that you're speaking to has a whole different role in your care. So even though you may come in, you hit your hand, these tablets may be helpful, every single intervention or medication can have a potential complication. And just like you say, you might take the painkiller and feel better, but that's not what I'm looking for sometimes. I'm giving you medication to maybe help with the swelling, help with the healing process, and particularly for antibiotics. We'll feel sick. You take antibiotics for 3 days and you feel good and you're like, oh gosh, I don't need this. But things like that can actually promote stuff like antibiotic resistance. So when I'm telling you, take your medication, complete it, it's not just because I want you to feel better, but I'm also helping the underlying process. And sometimes I'm even doing some public health work and trying to ensure that we keep everybody else protected as well.
Neville, I don't know if you are guilty of doing this, but some of us are guilty of, if we have a pain, we don't go to the doctor, we go online. Google pain in hand, Google pain in shoulder. Why should people not do that?
So there's several reasons why. I will tell you one thing for sure. I mean, of course, in our own practice, I use Google, I use, the internet to find information. But when you're Googling pain in your right hand and I'm Googling pain in your right hand, it's 2 completely different Google searches. I'm able to look at that information and use the knowledge that I've learned from school to kind of help me fine-tune my diagnosis. But the truth is, you don't know what to input into these search engines and even AI. I mean, you can say I have pain in my hand, but they're not going to ask you those other questions. When you're talking to me as your physicians, I have a list of differentials or a list of diagnoses rather that I'm kind of ticking off and trying to exclude.
Why some doctors would see, I'm a football coach, and I would go to a medical doctor with a player and say, him get a lick here. And the doctor say, him can't play for 2 weeks. I go to a sports medicine doctor with the same thing, and him say, no man, if him get hit pan it, will hurt him, but him all right, him can play. With the communication between patient and doctor, why sometimes it's not. I know everybody not will see the same thing and say the same exactly, but sometimes it,
You know, this is such an excellent question, and I have one word to answer it, and it's going to be experience. So coming to me as a general practitioner, I do not have the experience as a sports medicine physician or even an emergency medicine physician, but my duty is always going to be to ensure that you are safe. Right? This is the reasons why you don't go to one doctor to see everything, and sometimes a doctor will say, here what? I'm going to start you out, but you really and truly need to see a specialist, because they're going to use their years of experience, the knowledge that they have, to give you a more optimal care than I can maybe provide to you in that time.
Mm-hmm. So again, the communication between doctor and patient is key. As far as you know, from where you're coming from, is that being done? And is that being done in the way it should be done?
So, I mean, that's a very layered question to answer. And I would
prefer when you say it's a great question. But go on.
It's a layered question because we have to look at it from so many different ways. The fact that we have resource constraints in various systems, the fact that we may have time issues, but at an individual level, from we're trained in school and even with our continuing medical education, we are always taught, and even more so now, where care is actually patient-centered. We've kind of moved away from a paternalistic care, which means that the doctor is telling you what to do. No, there's an expectation that you are involved in your care and you are involved in your management. So on an individual level, each doctor is taught, and each healthcare professional actually is taught and practices that level of communication. There are gonna be resource constraints and different things that make a difference in that. And this is where things like public health and public campaigns are gonna be extremely important.
So should a patient demand that the doctor, be more responsive? Because some persons might be a little shy. What do you think about that?
Don't be shy. But it's a difficult thing to do. And one of the things I've worked on is actually health education, a way to help patients become more confident in asking questions. But I would say you don't ever want to leave a room not understanding. And the truth is, if you tell me, Neville, that you don't understand, or you say, boy, can you explain this to me again? We're not judging you. We're not looking at you and saying,
well, I'm done, see?
Yeah, because we also understand. And you have to remember, most of us are trained at UE or other local medical schools, and we practice in local public hospitals. And therefore, we see a wide variety of patients with different education levels and different levels of understanding. So we are not looking at you and thinking, Lord God, you don't see? Yeah. No, ask your questions, You want to ensure that when you leave, you can get an understanding.
In your personal service, for want of a better word, do you find people saying, Doc, but you never explained this thing to me properly? Do you find things like that will happen?
Of course. So, and even more so when I just started, and someone gave me the advice to not ask, do you understand? Because most people are going to say yes. Mm-hmm. And instead they said, let them explain back to you. And when persons are explaining back to you, generally that's when you can kind of pick up, they kind of understand, but let me clarify these things. And it also helps them feel more comfortable talking back to you and not feeling like they have to say, Doc, I don't really get this,
Yeah.
Sorry.
Go ahead.
How do you treat children or teens? Some of them are not very talkative. How do you bring out the information from them?
When it comes to kids, when it comes to teenagers, I'm not a PD expert at all. It does take a special type of magic to deal with younger folks, but it's gonna be about making them feel comfortable. And one of the top 10 things is oftentimes they're gonna come with their parent and say, you're the child, you're the parent. I'm not gonna say, okay, so why is she here today? I'm gonna talk to you. And you wanna reach down on their level, speak to them softly, kind of make a little fun with them, toy with them. And you'll find if you spend a little time over time, they will open up. But pediatricians are out there doing the Lord's work, honestly.
Final question from me, and you have answered it already. So I have a bad ankle. You give me 10 tablets, I take 2 and I am fine. I run in like the greatest horse in the world. Why I need to take the other 8?
You're fine for now. So as I said,
But the swelling gone down, I'm not feeling any pain, I can kick the ball
Take
again.
the medication, Neville.
No, I know, but why I need to take the other yet? I mean, you answered it, but seriously.
So it's important that as patients we adhere, I'm going to use that word, to the medication that's prescribed, unless of course there are complications, then of course you go back to the pharmacy, go back to the doctor. But that is because we're oftentimes treating not just what you can see, but underlying cause. And more importantly, we're trying to prevent complications further down in the line.
So you're suggesting that maybe it's not fully healed, even though meetings said fully healed.
Exactly.
Beautifully explained, by the way.
Thank you.
Thank you so much for coming this morning. Samantha Johnson. And you're one of them, doctor, we do everything, right? Yeah. Don't you?
No, right now I only do food.
Oh. All right. There you go. I'm a footballer. I need 10 minutes to your health. We'll do it again next Thursday. What going on now?
Yes, when we come back, our pickleball, we're going to play pickleball. Can you play pickleball? Yeah, let's stay with us. We'll be right back.
Promise our ball is meat.